Hey everybody, this is Dr. Joe Borio with this week's Health Kick, and today I wanted to tackle a topic that seems to be quite controversial in really today's society, and that deals with children, and it deals with psychotropic drugs, medications, medicating our kids for psychiatric issues and psychiatric problems. It is a topic that's controversial and sensitive because I know myself as a father of two boys that there's nothing more important than making the right choice for your child. So when a parent commits to making a decision, there's emotion that's involved, certainly. There's some education and knowledge involved on a certain topic. Sometimes it's authoritative knowledge, meaning you're listening to experts or so-called experts, unfortunately, in many cases. And unfortunately, we're often only exposed to one point of view, one side of the story. So what I like to do in those situations is I like to kind of step back for a minute and kind of look at the topic with some common sense. Let's step back and look at it that way. And when we look at what we're doing with children, we look at their behavior, for example, and I'm talking about children, let's say, that have ADD or ADHD. I'm talking about children that we call them bipolar now, or depressed, or what have you. We need to step back and look at, well, does that behavior, those so-called diagnoses, and that itself is tough to swallow if you start reading books or the books they use to diagnose psychiatric issues. So that itself is another topic for a health kick. But when we start to look at that, if we take those very ambiguous, very vague descriptions to use, or clinical assessments, if you will, to diagnose a particular problem, and let's say we use that time frame in that evaluation and those findings, if we take that same viewpoint to other areas in our country, is there a change in the percentage? In other words, do we have more kids with bipolar, depression, anxiety? Do we have more of those children per capita, per population? Let's say in New York City versus upstate New York. Let's say Dallas, Texas versus Kentucky. Let's say even in different societies. In other words, if I look at the Amish, for example, or I look at the Mennonites, and I look at them and them being their society, and I look at the children in their society, do we have a bunch of kids that are bipolar or that have anxiety disorder percentage-wise than we do in other areas of the country? And then we need to look at, the common sense, I guess, evaluation of genetics. Is it a genetic thing? I hear that being described. Is it environmental? Is it behavioral? I think when we really step back and look at it, what you're going to realize is if you look at the United States versus Mexico versus Canada versus Italy, Spain, Norway, Japan, and so forth, you're going to find that the United States is crazy. We're off the mark. We're talking over 20% now of our children are being prescribed psychotropic medication. And what's really scary is the side effect of this medication is a severe form of what they're taking the drug for. So in other words, if your child is described as anxious or depressed, and I certainly don't mean that they don't exhibit some of that behavior, by prescribing them a psychotropic drug, what you're often causing the child to do is have hallucinations, worse depression, more severe depression or episodes of depression, more anxiety, or suicidal tendencies. They also cause delusional episodes. And what's really scary, and again, I know it's controversial, but you start to look at these kids that are doing these killings, and some of the adults, for example, and they're all on psychotropic drugs. So the argument by the doctors often is that, they're taking the drugs because they had these problems, and if it wasn't for the drugs, look what would have happened. But that's one way to look at it. Another way to look at it is some of these kids are really getting delusional, and it may be the medication, maybe not in all of them, but certainly in some of them, that's causing them to be delusional. They're delusional episodes where they develop a psychosis as a side effect of the drug. So let's look at that and make a decision. Are we really doing what's best for our children, or are we doing it from the wrong paradigm? meaning that for some reason their body, chemically is imbalanced, genetically or environmentally or what have you. We need to take a look at what we're exposing our kids to as far as behavioral, what they're being exposed to, learning. We need to look at exposed to nutritionally, movement, and they all play a dramatic role on the neurology of the body. So by that, what I mean is, let's take movement, for example. It's all the things I end my health kicks with. We're not meant to sit around and move. The brain, your brain, your cerebrum, is actually energized by body movement. So when you take a child and you sit them in a classroom, and you take a child after school now, and they sit back and play Xbox for hours on end, or they sit in front of a TV hours on end, what happens is they get less neurology. There's less stimulation in the brain. The brain doesn't develop connections and synapses. Think of your brain as like a huge switch station that connects to all these telephone lines in all of upstate New York. That's where I live, right? So you got all these switchboards. If nobody's using the phones, right, there's no electricity, there's no communication going to the switchboard, and therefore, that board doesn't work as well. It's kind of a dead board, and that's often what happens to the brain. So movement, exercise, kinesiology, movement, especially more so in boys, but we learn through movement. So movement is lacking in our environment, in our society, and therefore it's less development for the brain, so the brain becomes unhealthy. So you talk about serotonin reuptake inhibitors, which is what these drugs are. Guess what causes serotonin to be released? Body movement, activity of the body, physical movement of the body. And that's true with adults. So they do a study in Stanford and they say, geez, guess what? You take people that do regular exercise that are depressed, they have a better result than, and it was done at Duke as well, they have a better result in treating depression and anxiety than they had with the drug. And there's no side effect and it was free. So just getting off your butt, moving around had a dramatic effect in how healthy your body was. Now you talk about nutrition. You start putting a bunch of toxins in your body, processed foods, not good for the brain. Our diets are very deficient in omega-3 fats, which are like the fish oil, if you will, or EFA, essential fatty acids. Our kids should be dumping that. Remember, when we were kids, our parents used to give us cod liver oil. I don't even know if my parents knew why, but they said it was good for us. It's phenomenally good for your brain. Your brain is made of those types of fats. Your brain needs that. The neurology of your body needs that kind of fat. So you need to give your kids a couple of capsules or a couple of teaspoons or some really good lemon flavored, strawberry flavored flaxseed oil or omega-3 oils now. They should be on that every day. So that's a huge part. Also how we learn. In other words, for learning by bits of information, we're not processing. So we're getting quantitative but not qualitative. By that I mean we're getting bits of information, bits of data, but we're not processing. We're not actually cerebrally digesting it. That's the word I guess I just made up. But we're not digesting it. So therefore, there aren't other synapses in the brain. So when you watch cartoons or you watch Xbox or you learn through these digital processes, you're only getting bits. It's like headline news. You're only getting bits of information, and the brain doesn't develop neurology. We're not using problem solving. We're not using thought. We're not using social skills. So that doesn't mean you can't play Xbox, and it doesn't mean you can't watch a cartoon, and it doesn't mean you can't have a piece of pizza or soda. The question is that the mainstay in your diet, or is that treat night? Is that something you're doing on a Saturday or a Sunday where you're doing a treat for the kids, or is that day in and day out? That's just some real simple stuff to go over. The last is movement to the brain and neurology. Chiropractors, our biggest concern is the movement, especially in the upper cervical area of the brain. And what science is showing is if this upper cervical part of the brain doesn't move, what happens is it causes stagnation, both neurology and nutritionally, to the brain. You've got fluid that floats within the brain, and that fluid doesn't move as well, and it stagnates the neurology of the brain. So adjustments to the upper cervical with children should be, there's so many reasons why kids need to be adjusted. Another great reason why everybody in your family needs to be under chiropractic care. We're running out of time, guys. Definitely great information for another topic. Listen, remember to exercise, eat well, drink a lot of water, get a good night's sleep, and remember you, your mother, your father, your grandfather, everybody you know needs to be under regular chiropractic care. And don't forget those good thoughts. We got to say good thoughts to ourselves and our brain. So talk well to ourselves. Listen, this has been Dr. Joe Borio with this week's Health Kick. Have a great, healthy week. I'll talk to you guys next week.